Well, yeah, let me think. Well,
Tough one.
That's such a big one.
Interesting question.
Why does our agenda focus on doing things the same way? If we're talking about solving Africa's challenges for healthcare, we're actually talking about doing business unusual. Now certainly we can't do business unusual by looking at the operational issues from day to day. And I think, so it's creating the space for innovation and acknowledging those contributions.
Oh, there's so many challenges in healthcare at the moment, especially in South Africa. I think we've lost focus of the person we're working with. People have become numbers.
Since I'm lucky enough to be able to afford medical aid that allows me to get an insulin pump because I have type 1 diabetes, but unfortunately the cost is prohibitive for lots of people, and especially for children and the parents who have to manage their conditions, it becomes very difficult.
I think that healthcare in the future needs to have at its center the caring process, the caring ethos, because regardless of what you can or can't do for a person technologically, care should be at the core of it.
I think some of the biggest challenges are around making healthcare more accessible and more affordable for more people in South Africa and in the world.
for me, I feel it's pretty much unfair because healthcare is a necessary thing, you know, for everyone.
What I think the biggest challenges are in healthcare is that I think that we need to get communities more involved.
Particularly in South Africa and in many countries where the burden is so great, the resources so few, we feel paralysed.
The opportunity for reimagining healthcare is to change where healthcare is delivered, by whom it's delivered, and why we deliver it. And these are all big questions, big opportunities that can lead to totally new discoveries and new innovations.
I have a vision where everything we focus on starts with prevention. Everything is legislated around prevention.
I really want us to kind of move away from almost this tick box healthcare system to say that we've got a clinic in a little rural town, therefore there is healthcare. Absolutely, that's not healthcare. And so we're talking about outcomes that improve lifespan.
I'd like my children to be able to access the best care that's available globally right here at home.
I think a healthcare system that is filled with hope, where people working within the system has regained their hope and motivation for why they are doing their jobs.
Yet we still have problems, but the most accessible thing is clean water. It should be like water. Wherever you go, it's like water. Wherever you go, you are going to see water. If I go here, if I go to Eastern Cape, I should be able to access the same healthcare service in Eastern Cape that I'm accessing in Cape Town or in Johannesburg.
What I think in 20 years from now is the community needs to have better infrastructure, such as a team of nurses and doctors and physios and OTs and that sort of thing.
So whether it's, innovation at the process level, so how do we get patients through a pharmacy quicker, or whether it's innovation around drug discovery, or whether it's actually innovation around complete systems overhaul in developing a national health insurance.
Innovation for me is the possibility to imagine how things could be different and finding the way to get there. Trying, testing, failing, working together and realizing the possibilities.
I think we can all be innovative. They're just various degrees of innovation. But I think all of them have a place in a time, and all of them can be beneficial, especially in healthcare.
But I think we need to push the boundaries and reinvent and redesign our thinking.
Making it better.
To me, innovation means coming up with extraordinary ideas and improve the lives of people in the society.
It's about trying to find new ways and better ways of solving challenges that we have.
Innovation means stop, think, and make a plan.
Healthcare innovation needs to be about the innovation side as well as the design aspect, and applying it in a systematic way so that you come up with an innovation which becomes a solution.
I think we have to do things differently. What we're doing up until now isn't working. We have to reimagine what a health system can look like.
We have to take a step back and imagine that hospitals are not necessarily the best ways to treat patients.
Communication and education are the two big things one needs to work with to make a change.
For me, I think support is the most important thing, because that's what motivates people to go the next step.
We are the innovators.
We are the innovators.
We are innovators.
We are the innovators.
We are the innovators.
We are the innovators.
The summit, the Innovation Summit, presents, I think, for the first time, a very real step forward, a progressive step that communicates to a broad range of stakeholders that to innovate in the delivery of healthcare is not an option. It's absolutely what we have to do. If we are going to turn the system around, we're going to have to innovate.